Hi everyone, I'm Dr. Z. I'm a clinical psychologist who specializes in transgender adult care. Welcome to my channel. If you're new here or a regular viewer that has not yet had a chance to subscribe, please make sure you do so that way you will be helping everybody else find this content. And if you don't yet follow me on Instagram, a link is below. Make sure you follow me on Instagram. I put out amazing and fun and engaging and supportive content on there as well, and I would love to connect with all of you. For today's video, let's talk about what are some of the steps you can take? What are some of the things you can do when you're not really sure what exactly your gender identity is? This is a question that I have a lot of young adults, 18 and up, ask me about. This is also a question that I have a lot of older adults who, what we say, you act just correct, right? Happened. Meaning you may not have an ongoing history of struggling and living with gender dysphoria, and suddenly you just woke up realizing that you're not comfortable with your assigned gender. So those are the two instances where I get people trying to figure out where they are on a gender spectrum. And usually a lot of people will oscillate. Am I really fully masculine as a trans man? Am I fully trans woman? Or am I more non-binary, right? Or am I maybe even gender fluid? Because remember, there's difference. Non-binary is exclusively neither male nor female. Gender fluid is an individual who is able to actually navigate between male and female. So they're not really necessarily need to have that not exclusively male or female, right? Non-binary, at least in my experience with people, is more not leaning toward, not even identifying with the existence of the binaries. So it's a very important question to ask. And a lot of people, especially when they stepped into elements of social transition, still continue to question themselves where they are on the whole gender thing. And a lot of people want to step into medical transition and not sure, or want to feel more sense of certainty before they can commit to hormones, because while estrogen is a much more, I like to say, forgiving for hormone, meaning changes don't take really quickly, physical changes at least. And when they do take, one of the biggest physical changes is, slow growth of the breast. The masculinizing hormone, testosterone, on the other hand, is less forgiving, meaning people can and do experience irreversible changes relatively quickly. Deepening of the voice, facial hair growth, just to name a few. So, makes sense. If you're not sure what gender identity you are, that you're going to pause on entering medical transition. And in fact, I highly, highly encourage and always, always preach this. If you're not sure what your gender identity is, medical surgical should be the last places to look at. This has nothing to do with gatekeeping. You all know me. I am all for gender affirming treatments. I'm not for gender affirming treatments as a form of trying to figure out your gender identity. That's not the way to go. Hormones, in a lot of cases, affirm what you already feel and know about yourself. Difference between affirm what you already know and feel about yourself and I'm confused and I need hormones to tell me. Okay? So just giving you my 2 cents. But of course, this content is for adults. As adults, you can do what you think and feel best for you, regardless of my professional personal opinion. So, what do you do when you're not sure? And here's the thing. One of the first things that I recommend, and if you're watching this and you haven't done this, you should definitely do that, in my opinion. But if you have already done this, I will also tell you why this also still leaves you feeling very confused. One of the first things that I would always recommend, if you're not sure, is to start slowly taking steps within parameters of social gender transition. What is social gender transition? Playing around and exploring your relationship to your gender role, playing around and exploring your relationship to your gender expression. How do you like to express yourself? Playing around and stepping into gender presentation. How do you want to present yourself to the world? All those three: expression, role, presentation. And as you play with that socially, through um, through maybe the way you starting to navigate and process things. Maybe the way you approached your work has always been this strong, masculine, assertive, active-oriented energy, and you're gonna try it now with more flow, more receptivity, more kind of organic, less rigid energy, which is more feminine energy. Maybe you are going to take on an activity that in today's world, stereotypically, when it comes to gender roles, is stereotypically either what we assign men tend to do or assign women tend to do. And maybe you're going to step into it and explore what that feels for you like. What does it feel for you to be in that role, right? So what does it feel to engage in activities that are stereotypically tends to fall strongly into one binary or another? Even though all those activities in the world are genderless, but we're humans, so goddamn brilliant. We had to gender everything to the point where we're now suffocating under our own gender labels, right? So explore that. And then, how do you like to present to the world? How do you like, what's your presentation as a person? And try to do all of that without really assigning labels yet. How do you like to present in terms of your aesthetics? A lot of you are deeply familiar with me over the years, so my content. By now, you know Dr. Z has such a particular aesthetic, right? That it's when I put pictures from when I had long hair or no bangs or different hair color, none of you can even recognize me these days. Or even when I make content without glasses, with this bob, some of you still say, is this you, Dr. Z? I didn't recognize you. This is my external aesthetic, right? Some people think I actually been trying very hard to look like Edna Mode, but I started to have my haircut in the style, and then people started pointing out I look like Edna, and then I realized, unbeknown to me, I did this subconsciously. But yeah, this is right, bold glasses. Like you come to my YouTube channel, you turn on my next video. Do you ever expect to find me sitting here in like floral print? Probably not. Do you ever expect to see me without some shade of red lipstick? Probably not. Right? So, in other words, this is how I feel very comfortable presenting myself. This is not only how I feel comfortable presenting myself, this is how I see myself, how I identify. I love black clothes. I love bold statement glasses, right? I love bold red lips. That's me. It's my, it's like my relationship to my womanhood. It's my relationship to that dark feminine in me. I love that. I love that. So, what about your presentation? Without again labeling it, how do you want to, when you step out to the world, how do you want the world to see you? Not how the world tells you you should look, right? But how do you want to be seen, right? I'm not going to lie, full transparency. I want to look interesting and mysterious. Let's just say those two attributes, right? And so an element of my hair and my makeup and my clothes, you can already see kind of lines up with that emotive feel, right? Now, do everybody find me interesting and intriguing and mysterious? Probably not, right? It's all in our heads. Our own archetypal constellation of what makes us feel yummy about ourselves is in our heads. And that's okay. That's what you need to figure out. What is your internal archetypal constellation in regards to, in this case, in regards to gender role, gender expression, gender presentation. And you gotta do this all in the social ways where it is all fully reversible. Cut your hair, color your hair, grow your hair, right? Go ahead and if you have beard, shave your beard, see what that feels like. Wear pants, wear skirts, wear color, wear print. Try to super hyper feminize if you feel comfortable at home. Try to super masculinize. Try certain body forms that will give you the body enhancement, right? Try to wear strap up. What does it feel like to wear strap up and feel like you have a dick between your legs? What does it feel like to wear breast forms and to feel like you have breasts? These are all excellent, excellent, excellent ways to find out what's happening to internally, right? How did I derive to, let's stick it with my presentation. How did I derive to this? I didn't always wear black. There were times when I wore color and print, and guess what I found out? I don't like it. It doesn't feel right. I can wear it, but it's not me. So that's how you can, all of the social exploration, put yourself into your own kind of container, your own laboratory of exploration, social explore, 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 explore. Now, remember how I said in the beginning, some of you are already doing it and still feel confused about your gender identity. Part of that confusion for a lot of you is going to arise out of the fact that you just might be neither strongly trans-masculine or trans-feminine. In other words, you may not strongly lean toward one or another binary. A lot of times it is a little bit easier to find out if you lean strongly toward the binaries. But when you are somewhere in the middle, when you want to have ambiguous gender, when you want to have a androgynous gender, you want to be identifying as non-binary or non-binary but a little bit femme or non-binary a little bit masc or gender fluid or genderqueer or demigender, all of those gender, beautiful tapestry of gender identities that sit in the middle are sometimes harder to anchor within ourselves. I'll tell you why. Because a lot of times it's not that you don't feel right in that place. It's that when you start to experiment and social explore and show up in the world as a part of the middle part, what happens is that the world doesn't yet know the cues, doesn't have the cues. It's not there yet with you. And so you may feel non-binary, but the minute you step outside and you present more androgynously, people look at you and a lot of people will think, what cues am I picking up? If I'm picking up more female cues, you're a woman. If I'm picking up more masculine cues, you're a man. Fortunately, this is changing, right? A lot of people are now more mindful of it. A lot of people are just more mindful about how we talk and gender people. We tend not to jump to it, regardless of what cues we get. But this is going to be a challenge for you. If you've done a lot of social exploring and experimentation and presenting socially to the world from the middle kind of spectrum, and you're still very, very confused, chances are it is because you're not you're not getting that external validation, and you have to acknowledge that you may not get that external validation, and that's okay. You're not getting it not because they don't see you. You're not getting it because they can't. They have not learned how to see you yet. Do you understand? They they're not aware of it enough to be able to pick it up. The most important thing here is how you feel. If you feel that somewhere in the middle is like, yeah, this just feels right. And anytime I feel lean more toward masculine or feminine, it's just too much. Trust you, God. Trust your feelings. We've been taught to disregard our feelings, and you need to trust your feelings. But this is my recommendation, if you're still questioning your gender, create the petri dish of social experiences to dive deeper and deeper and deeper in, and just pay attention to how you feel without jumping in the medical surgical. That is just going to confuse. I promise you, if you're not sure, it's going to make you more confused. Those options are going to be there for you when you're ready. They're not going to go anywhere. I promise you, it's going to be there for you when you are ready. We live in a world where we need to know now and we need to figure it out now, right? I'm going on a diet. I need to lose 20 pounds tomorrow. No. This is not Amazon Prime delivery, people. This is not putting order into Amazon with Prime membership, asking, tell me what my gender is, and getting tomorrow a package with a label that tells you who you are. You have to be patient. You owe this to yourself. And here's another thing to consider. Your uncertainty, you not knowing where you are, is also telling you something. So sit with it. Allow that to sink in. Now, comment below. Let me know what some of you have tried. Those of you who have been through this process, what helped you. Maybe people who had a certainty and knowing, where did that come from? Share with everybody else. Comment below. Love hearing all of your comments, and I will see you all next time. Goodbye.